First presentation is by Dr. Madhumita, corneal neural imaging using in Vivo confocal microscopy in cases of congenital corneal anesthesia. Dr. Madhumita. And next presenter may please be ready. Dr. Radhika.
Good afternoon. I have no financial interest to disclose. Congenital corneal anesthesia is a rare complex neurological disorder which can occur in isolation, involve all branches of the trigeminal nerve, or as a more universal congenital insensitivity to pain and anhidrosis. It usually presents between 8 to 12 months with poor vision, photophobia, conjunctival injection, and corneal ulceration, characteristically with the absence of pain and distress. It goes through the stages of an initial geographic dry spot formation, followed by an epithelial breakdown and stromal lysis, which can further go on to a corneal perforation. It is a challenging disease to diagnose, and it is often misdiagnosed, with the only effective treatment strategy being a lateral traceraphy. A number of studies have been done to theorize the etiopathogenesis of this disease. However, no studies have been done examining the architecture of the corneal nerves in these conditions. The normal corneal nerves are present as the stromal plexus and the subbasal plexus, with the subbasal plexus being thin and beaded. Up to recently, most of our knowledge of the corneal neural architecture was based on the examination of corneal buttons through light and electron microscope. However, due to the spontaneous autolysis of these nerves soon after death, much data was not available for us. This changed with confocal microscopy. Confocal microscopy provides us an optical section of the living cornea and allows a detailed evaluation of the living cornea both in its physiological and pathological states. This is a representative image of normal subbasal nerves through in vivo confocal microscopy. A number of studies have been done on corneal nerve anatomy using in vivo confocal microscopy. However, no such studies have been done in cases of congenital corneal anesthesia. Therefore, our objective was the quantitative estimation and comparison of the corneal neural architecture using real-time in vivo confocal microscopy, particularly in patients with congenital corneal anesthesia, and comparing them to a control population. The study was conducted in Tej Kohli Cornea Institute. It was a prospective, non-consecutive, comparative interventional clinical case series. The study population included cases of congenital corneal anesthesia which fulfilled the inclusion criteria, and the controls were their unaffected siblings or parent. The inclusion and exclusion criteria were listed and adhered to. IRB approval was obtained and informed written consent taken. All patients underwent a comprehensive eye examination. Corneal neural imaging was done using the NIDEC Confoscan 4. And these images were, of these images, 3 to 5 of the best images were randomized and analyzed. The architecture that was studied included the length and thickness of the corneal nerves, the dichotomous pattern, presence of beads, and the density of the nerves. These are sample images of the study of a case and a control. Statistical analysis was done, and all variables were found to be continuous. Those with normal distribution were analyzed using the student t-test and the others using the Mann-Whitney test. A p-value of 0.05 was taken as significant. 12 eyes of 8 cases and 16 eyes of 8 controls were analyzed. It was noted on the analysis of the dichotomous pattern that the median in the controls was 82% as compared to 45% in the cases. although there was a marginally overlapping interquartile range, the p-value was found to be 0.1. On analysis of the length, breadth, and density, it was found that the density of the corneal nerves was significantly lower in cases as compared to controls, with a mean of 4.11 compared to 6.52 millimeters per square millimeter. The p-value was found to be 0.007. From this study, we see that there is a significant reduction in the density of nerves in cases of CCA as compared to a normal population. There is also a noticeable difference in the presence of dichotomous pattern of the nerves. Therefore, there is a correlation between the functional loss, that is the absent corneal sensation, and the anatomical decrease, that is the reduced subbasal nerve density of corneal nerves in cases of congenital corneal anesthesia. And although the sample size was small, considering the rarity of the disease, these findings can be considered as relevant. Thank you.
Just a minute, Dr. Madhumita. How did you suspect this corneal anesthesia? How did you suspect it in your
These
patients?
were children who had no senses, as in there was decreased cheering. They had on putting any drops into their eyes, they had no reflex blinking, no irritation. In children especially, there's a lot of resistance that we usually see when we try to examine them or put drops in them. This wasn't there in these patients.
Okay. And what was the usual age group that you found in your study?
The patients were diagnosed earlier on, but the study was done for cooperative patients, so that was above 8 years old.
Mm-hmm. Okay.